Action.
Hey, Dr. Cole here, and I'm going to speak to you today about questions you might ask when you have a hair transplant consultation. Now, there's no right or wrong question. If you have a question, don't be afraid to ask it. Now, I'm going to start with a question that's very important, given that today everybody seems to want to add hair transplant surgery to their practice. I don't care if it's a dermatologist or a plastic surgeon or a day spa. They want to add hair transplant surgery. And the reason is that a little over 30 years ago, we started developing very good techniques to perform hair restoration surgery, and we transformed this procedure from an unsightly, pluggy, scarring, unacceptable cosmetic disfiguration into something that is aesthetically pleasing and that, no one can tell that it's a hair transplant. So everything changed with a new group of physicians beginning in around 1990. And so the first question you want to ask is, who is going to do my surgery? There are a lot of clinics that are buying equipment and the assistants perform the entire surgery. Now, most of these assistants are not really trained well. They certainly have never been to medical school, and almost none of them have been through registered nurse training. They're not licensed practical nurses, and they're not PAs. Now, on occasion, you may have a physician who sits in the room while the assistant performs the procedure, but usually that physician is going to be off in another room doing consultations or other procedures, and that assistant will do the entire surgery. So who is going to do my surgery, and what part of the surgery will they perform? Now, since the early 1990s, it's been common practice to allow assistants to help us implant the grafts, but that's about all they should be doing, assisting with the procedure while the surgeon performs the procedure and helping to get the grafts in after they've been taken out and the physician has designed the hairline and made the recipient sites. So that's the first big question. Who is going to do my surgery? I recently had a patient who had an artist procedure, and he went to a day spa. There was a PA in the room that sat there while the assistants performed the entire extraction process. And then once the extraction process was done, the physician's assistant left the room, and these surgical assistants, surgical technicians, they're really not even trained surgical assistants usually. They said, what kind of hairline would you like? They designed the hairline. They made the recipient sites. They placed the grafts. And, of course, the result was, number one, pluggy. Number two, very low in terms of density. Number three, it provided no significant degree of coverage. And finally, the patient was left looking like he'd had a hair transplant, and now instead of having what he should have been a full head of hair, he looked like he needed to have, a repair procedure done, which I performed, and he had a great outcome. He had great donor area characteristics, and of course he had a great outcome. So who's going to do the surgery? The next question is, am I a good candidate to perform what I want to accomplish? So it's in the surgeon's realm to determine what you want to do. What are your goals? And so the first question is, you want to make sure, am I a good candidate for what I want to do? If I want a full head of hair, this is only possible if there is a limited amount of hair loss. So determining what we can accomplish is always a supply and demand issue. In other words, you have to have enough donor area, follicular units or hair, to accomplish coverage in the surface area that you have hair loss in. Once you exceed a certain limit, then you're not a real good candidate. For example, I had a patient come in a week ago who was a Norwood Class 7 in his early 50s, and the hair loss was so extreme, I labeled him a Norwood Class 8. Clearly he does not have enough head hair to accomplish what he wanted, which was a full head of hair. And so there's no way I can accomplish that. So the first thing the surgeon has to do is evaluate your donor area. They've got to evaluate how much hair loss you have, and then they have to try to match what they find in the donor area to your specific goals. And if your goals are extreme, you're not going to be a candidate to accomplish that. So it's not just placating what the patient wants. It's making sure that we can accomplish what the patient wants based on their donor area characteristics and their degree of hair loss. So it's all predicated on this. And so the next question is, what specific characteristics make me a candidate for hair restoration surgery or for what I want to accomplish? And this means, you got to know the donor area density. You've got to know the surface area of hair loss. You've got to know the hair diameter that we're working with, the average number of hairs per follicular group or follicular unit, and you have to know how many are available, how many follicular units are available in the donor area to accomplish the mission. We can, on some instances, go outside the traditional safe donor area in some individuals. We can also move into some sources of body hair, such as the beard, but patients have to be comfortable with these other sources of hair. So, ask your surgeon, what characteristics do I have that make me a good candidate for what I want to do? If the surgeon just wants to do the surgery and get money from you, they're not really trained all that well in determining what makes you a good candidate. So ask specifically, how many follicular units do I have? What's my hair diameter? How many hairs and grafts will I need to accomplish what I want based on the surface area loss that I have? So they need to evaluate all of these things. And so another good question is, what makes you, doctor, special? What about your procedure is special compared to everyone else? Well, it might be that they, have really good training in that procedure. That might be that they've done a whole bunch of these procedures. It might be that they have consistent results. It might be that their results are very natural. But if the only thing making someone special is the fact that they offer a surgery that 80% of the other surgeons in the world offer, that's not very unique. That's not very special. So what's special about this particular doctor? Did they develop the instruments? Did they develop the technique? Did they get special hands-on training with individuals who are highly experienced in the procedure? And so the next question I would want to know is, how many of these procedures that you recommend or that I want? Let's say I want a specific procedure. The doctor might recommend a different procedure, but you're insistent you want this particular technique. How many of these particular procedures does your physician perform on a regular basis? And regular meaning every day. And if it's, once or twice a month, this is not someone you want performing that surgery. If you want, for example, FUE, and your surgeon is recommending an FUT strip surgery, immediately you do not want this individual performing your procedure. First of all, he doesn't believe in FUE. Secondly, he's not doing as much FUE as you would want. If I were going to get, let's say, a facelift, I would want somebody who performs a facelift every single week. And I would prefer someone who does facelifts every day. I would want somebody who has great results. That's what makes them special. Do they teach the procedure? Are they in high demand in the educational circle? I see the vast majority of hair restoration surgeons are not in high demand to lecture, and the vast majority do not lecture. Nobody really cares what they have to say because they don't have anything new or unique or special to add to a medical meeting. These are not the individuals I would want performing my surgery. I want the cutting edge guys, the guys that are doing, they're leaders in the field, not people that are followers. And most of the surgeons are followers. And then a good question is, why did you become a hair transplant surgeon? For me, it was a labor of love. When I got into this field, every result was bad. All patients had terrible results. They were scarred, they were disfigured, it was unsightly. You were a cosmetic cripple. And so for me, it was creating a procedure that was going to be aesthetically pleasing, something that patients would be proud of, and that other individuals could not tell was a hair transplant. And, it was always my feeling that this was the best field of medicine, and I couldn't understand why anybody would go into any other field. I just loved hair restoration surgery. So why did they become a hair restoration surgeon? If it's just to make money, that's not a real good, reason to become a hair restoration surgeon. And that's what you see in these day spas. It's what you see when the dermatologist, who does primarily other procedures, begins to offer hair transplants, or when the plastic surgeon, who is doing consultations and other procedures while a team of nurses does a hair transplant. That's not what you want. You also don't want, for example, in Atlanta, there's a physician who used to do pain management, and he lost his ability to work with Medicare. And usually you lose that because of fraud. In other words, you perform procedures that the federal government deemed were unnecessary. And because he lost that ability, he decided to become a hair transplant doctor. That's not a good reason. You want guys who just love hair restoration surgery. So one example is somebody who had a hair transplant. These are people that are really, they care about hair loss. They care about their hair loss. And they might be more inclined to perform a really high quality surgery because they care about the result. But most of the guys I know who had hair transplants and jumped into the field did so for economic reasons and not because it was a labor of love. It really needs to be a labor of love. That way, when he's working on you, he really wants to be there. He cares about your result, or she. They care about your result. Find out how they build a hairline, and find out if they use microscopes to evaluate the grafts. So microscopes help you make sure that you have indeed one-hair grafts, and you have to make these one-hair grafts, and you need to do it under a microscope. So how do you build a hairline? If they just say, oh, we take the one-hair grafts that we harvest from the donor hair and we put them on the hairline, I can assure you that there aren't enough natural one-hair grafts to make a hairline. Not on anybody that's an average candidate for a hair transplant, or even a good candidate, or especially a great candidate for hair transplant. People with average or better than average donor density do not have many natural one-hair follicular units. If they're getting one hairs, it's usually because they're transecting hair follicles. That means they're amputating the hair follicle, and that means they're probably putting half a hair plus a full hair into the hairline, and a lot of these are going to grow two hair grafts. And I cannot tell you how many hairlines I see that have multiple hair grafts on the frontal hairline. 2 hair, 3 hair, even 4 hair grafts. So how do you build a hairline? Because if they don't know how to build that hairline, which includes, you're not doing at least 300 single hair grafts and sometimes 500, sometimes a little more, depending on the caliber of the hair. Coarser hair is going to require more 1 hair grafts than finer hair will. Darker hair will require more 1 hair grafts than lighter hair. But if you're not building a hairline correctly, you're going to have an unnatural appearance on that hairline, and this is not somebody you necessarily want to go to. And so let's talk about the questions that everybody seems to ask, like, how many grafts do I need? The better question is, why do I need this many grafts? And the answer is, it's a supply and demand. If you have a larger surface area of hair loss, you will need more grafts. So what density should we shoot for? Well, 40 to 50 grafts per square centimeter is very safe. In some instances, we can hit 60 grafts per square centimeter, but sometimes the yield is not as good, and so I don't advocate for this. There are surgeons who do 20 grafts per square centimeter. This is going to give you about 50% of the density that you should be getting. I would avoid these individuals. So how do you come up with this graft count? Well, it's like if we're planting trees on an acre of land. If we're transplanting 40 trees and you got 2 acres, we need 80 grafts. So it's looking at the surface area of hair loss and determining, based on that and on experience, how many grafts you need to cover this surface area. So the front of a scalp, for example, I see all kinds of patients who are recommended 4,000 grafts. And in the front, they might have, upper limit, 50 to 70 square centimeters of hair loss. And that's in the front. And, when you add the top, it gets closer to 70. So if you're sitting on 50 square centimeters and you're doing 50 grafts per square centimeter, that's easy to determine that you're not going to get 4,000 grafts into this surface area. It means that they're going to have to move outside this surface area. They're going to have to move into the top and into the crown. So if you have isolated frontal hair loss and they recommend 4,000 grafts, which is so common in Turkey, you know right away they don't know what they're doing. And so one of the common ploys in Turkey, for example, or in clinics that have very low graft price, is they will tell you need 4,000 grafts, okay? And when I see the patient after he's been there, he looks like he's got about 2,000 grafts. His donor area looks like they attempted 6,000 grafts, but he paid for 4,000 grafts. So if you go to a clinic and they charge half the amount of money, but recommend twice the number of grafts, they're automatically charging you the same amount of money, but you're not going to get 4,000 grafts. You're going to get probably 2,000. One of the other things you have to be aware of is a graft is usually more than one hair. It's 2 or 3 hairs, and sometimes 4. And on occasion it can be 5 and rarely 6. But a graft is a flicker unit is usually 2 to 4 hair grafts. And if the surgeon tells you need 2,000 hairs or 4,000 hairs, that's fewer than 2,000 grafts. Okay, and so if they're charging you, be careful that you're paying for the graft, not the hair, right? And so why do I need? How do you come up with that number? Okay, and it's surface area of hair loss times the density that they're going to try to transplant. And then there's the other question that patients always like to ask is cost. How much does it cost? Well, is cost really as important as the result? I've heard patients say, well, it's less expensive in Turkey, so I'm going to go to Turkey. And even if the result isn't that good, at least I'll have gotten a vacation in Turkey. And I'm like, are you kidding me? Yeah, the rest of your life is potentially going to be, concealed with a cap because the result is so ugly. It's disfiguring. It results in not just poor coverage, but the appearance that you had a hair transplant. You kidding me? Cost is more important to you than the result. That to these individuals, I say, well, listen, if that's the way you look at it, you're better off just to go take the vacation, and don't worry about your hair. Your hair loss will still be there, but at least you won't be forced to wear a hat to conceal the result that you obtained, or you won't be forced to have to go spend a whole bunch more money getting it repaired, or you won't, be left without donor area resources because they destroyed your donor area, giving you this horrible result. Rather, what I would encourage you to do is any really top-notch surgeon is going to be able to find ways to help patients that they like, patients that are in need, and patients that are acceptable candidates for what they want. And how do you do that? It's real simple. If you love what you're doing, you enjoy helping people. It doesn't mean you can necessarily help them precisely when they want to be helped, but there are ways to find time in your life, time in any busy surgeon's schedule to work these patients in. Not everybody was born a billionaire, and not everybody makes, six-figure salaries, and not everybody, is a trust fund baby. Some people are hardworking. They've got, children. They've got expenses. Maybe they're taking care of their parents. They've got a wife. We're not trying to get them divorced over, resolving their hair loss. We don't want to create marital discord. We want to help these people. You don't go into medicine, in my opinion, for economic reasons. You do it because you care about people. And, for example, in the United States, at least when I was going to medical school, these were the brightest people, in the school. And, there are certainly lots of ways to go through life making a whole bunch more money than you can as a physician, for sure. So these are people that really care about, medicine. They care about people, and they're going to find a way to solve your problem. So cost should be the least of your concerns. Somebody that's good and cares can find a way to get you on their schedule. Okay? So I hope this helps you in the consultation process. He certainly is not the limit of questions you can ask, but they're certainly important. And just understand, really try to understand what's behind that physician. Why are they doing what they're doing? Try to get a feel for whether they're, dedicated to their craft, or whether they're, it's more of a money type thing. And if it's money, it doesn't mean they aren't good, but, you earn money by being very good. You earn money by being passionate about what you do. And I don't care what it is. I don't care if it's sports, or whether it's, business, or whether it's medicine. The people who really care are the ones that put in the time, that become experts in what they do, and they're always going to be dedicated to great results. So thank you for your time.
ForHair is run by Dr. Cole with 30 years of hair restoration experience, and we offer the most cutting-edge technology available. In fact, the ForHair enterprise sub-company Cole Instruments manufactures custom-made tools and automated tools for hair restoration physicians all over the world. Our quality, expertise, and skills are superior to other clinics. Our reputation and results are the best in the world. It's time to restore your hair. It's time to choose ForHair.
We hope you enjoyed the video. Don't forget to hit the little bell button to get notifications of ForHair's video uploads. For online consultation, click on the link on the screen or in the video description.